consists of the cranium and the facial skeleton. The cranium is the bony container for the brain and the foundation for the facial skeleton. The cranium is made up of a number of originally separate bones. These lines of fusion, known as sutures, show where the bones are joined. The principal bones that form the cranium are the occipital bone behind and below, the parietal bone and temporal bone on each side, the sphenoid bone and the frontal bone. The two bones of the cranium that we're concerned with at present are the occipital bone and the lower part of the adjoining temporal bone. To see the full extent of the occipital bone, we'll take the mandible out of the picture. The occipital bone extends all the way from here at the back to here underneath. The most striking feature of the occipital bone is this large opening, the foramen magnum, through which the spinal cord and its accompanying structures pass. The part of the occipital bone in front of the foramen magnum is called the basilar part, often referred to as the base of the occiput. The two temporal bones converge on it from each side. We'll look at them in a minute. Let's look at the occipital bone on the inside in a skull that's been divided in the midline. Here's the foramen magnum. Here's the basilar part of the occipital bone. It slopes forwards and upwards, more steeply on the inside than on the underside, since it's triangular in sagittal section. Let's look at some more details in a skull that hasn't been colored. On each side of the anterior half of the foramen magnum are the two occipital condyles. The occipital condyles are the joint surfaces which articulate with the atlas vertebra to form the atlanto-occipital joints. We'll look at these joints in a minute. The outline of the front and the top of the cranium is well known to us from our everyday observation of surface anatomy. It's perhaps surprising to see how far round the back of the cranium curves, and what an extensive overhang there is behind. The overhang is formed by the part of the occipital bone that's behind the foramen magnum, the squamous part. The overhang is obscured by the neck muscles that are attached to this broad area on the occipital bone. The bone bears the marks of their attachment. This lump in the middle is the external occipital protuberance. This faint ridge, leading out toward the mastoid process, is the superior nuchal line. Below it is the inferior nuchal line. We'll meet the structures that are attached here later in this section. Now that we've looked at the occipital bone, let's take a look at the temporal bone. It's quite a complicated bone. To see its full extent, we'll again remove the mandible. The temporal bone goes from here on the outside to here underneath. This is the petrous part of the temporal bone. This is the squamous part. A prominent feature of the temporal bone is this large projection, the mastoid process. As we'll see, it's the origin of some of the muscles that move the head, including the sternocleidomastoid. It's easy to feel the mastoid process here, behind and below the ear. This is the zygomatic arch, formed largely by the temporal bone and partly by the adjoining zygomatic bone. Here on the underside of the root of the zygomatic arch, this complex curved surface articulates with the condyle of the mandible to form the temporomandibular joint. This is the external auditory meatus leading to the middle ear. This long, sharp projection is the styloid process. Just at the base of the styloid is the little stylomastoid foramen for the facial nerve. Medial to the styloid process are two major openings for blood vessels. The carotid canal passing forwards for the internal carotid artery, and the jugular foramen passing backwards for the internal jugular vein. Just above the occipital condyle is the hypoglossal canal for the hypoglossal nerve. Let's take a brief look at the occipital and temporal bones from the inside. Here's the squamous part of the occipital bone. Here's the basilar part. Here's the foramen magnum. Here's the squamous part of the temporal bone. Here's the petrous part, which contains the structures of the inner and middle ear. Here's the jugular foramen on the inside. This big groove behind it is for the sigmoid sinus, the main venous drainage channel for the brain. Below and medial to the jugular foramen is the hypoglossal canal. Above the jugular foramen is the internal auditory meatus for the vestibulocochlear and facial nerves. The carotid canal ends here at the foramen lacerum, as we'll see in the next section. To simplify the picture, we'll remove the mandible. The cavity for the eye is called the orbital cavity. It's protected on the outside by the thickened orbital margin. The opening for the nose leads to the right and left nasal cavities, which are separated by the nasal septum. The upper jaw, or maxilla, bears the upper teeth. The prominence of the cheekbone leads back to this bony arch, the zygomatic arch. The deepening hollow here is the temporal fossa. It's enclosed by this ridge, the temporal line, by the lateral orbital margin, and by the zygomatic arch. The temporal fossa contains the large temporalis muscle. The temporal fossa is continuous with this deeper hollow, the infratemporal fossa. The walls of the infratemporal fossa are formed by this part of the base of the skull and by the posterior part of the maxilla. The infratemporal fossa contains the pterygoid muscles and also this part of the mandible, the coronoid process. On the underside of the skull, we come to structures that we've seen already. Here's the foramen magnum, the basilar part of the occipital bone, and the petrous part of the temporal bone. Two thin sheets of bone project down from the base of the skull behind the maxilla. They're the pterygoid plates, lateral and medial. Between the two medial pterygoid plates are the posterior openings of the nasal cavities, the posterior nares, or choanae. The hard palate forms the roof of the mouth and the floor of the nasal cavities. Here inside the nasal cavities are the conchae, or turbinate bones. We'll look inside the nasal cavity in the next section. The posterior nares open into the nasopharynx, which lies in the space between the medial pterygoid plates, the base of the occiput, and the anterior arch of the atlas vertebra. In a minute, we'll look at the individual named bones that form the facial skeleton. Before we do that, we need to take a look at some of the features of the inside of the skull. This special skull has been cut away at a series of levels that are just above the floor of the cranium. The way it's been cut reflects the fact that there are two big steps in the floor of the cranium, formed by the sphenoid ridges and the petrous temporal bones. These divide the floor of the cranial cavity into three parts: the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. We saw the posterior cranial fossa in the previous section. In this section, we'll look at the main features of the anterior and middle cranial fossae. The bone that forms this upward bulge in the floor of the anterior fossa is the same bone that forms the roof of the orbit. This crest in the midline is called the crista galli. On either side of it is a depression, the base of which is formed by these small areas of thin perforated bone, the cribriform plates. The cribriform plate forms the very narrow roof of the nasal cavity. Here we can see it from below. The filaments of the olfactory nerve, which transmits the sense of smell, pass through the openings in the cribriform plate. This flat area behind the cribriform plates is the roof of a cavity that we'll see later, the sphenoid sinus. Now we'll move back to the middle cranial fossa. The bone that forms the side wall and floor of the middle cranial fossa also forms, on the outside of the skull, the wall of the temporal fossa and of the infratemporal fossa. We've seen that this is the roof of the orbit. The bone that forms the anterior wall of the middle temporal fossa also forms part of the orbit. It forms this posterior part of the lateral orbital wall. This complicated raised area in the middle is called the sella turcica. The main features of the sella turcica are this deep depression, the pituitary fossa for the pituitary gland, this shallow groove for the two optic nerves, and these four projections, the anterior and posterior clinoid processes. This sloping surface behind the posterior clinoid processes, the dorsum celli, is continuous with the base of the occiput. The floor of the middle cranial fossa is marked by numerous openings for nerves and blood vessels, which we'll come back to later in this section. Now we'll move on to look at the sphenoid bone. The sphenoid bone is extremely complex. It extends all the way from one side of the skull to the other. The sphenoid bone forms important parts of the underside and outside of the skull, and it forms part of the orbit. The sphenoid bone also forms this large and complicated part of the floor of the cranium. Here's a sphenoid bone all by itself. The sphenoid bone has a central part, and on each side three major projections: the lesser wing, the greater wing, and the pterygoid process. The central part of the sphenoid includes the clinoid processes and the pituitary fossa. The central part of the sphenoid bone is hollow, as we'll see. The lesser wing, which is the highest part of the sphenoid bone, forms the sphenoid ridge, which separates the anterior and middle cranial fossae. The underside of the lesser wing forms this small but important part of the back of the orbit. The greater wing of the sphenoid forms the front wall and part of the floor of the middle cranial fossa. On the outside, the greater wing forms this part of the temporal and infratemporal fossae, and it also forms this large part of the lateral wall of the orbit. The greater wing and the lesser wing are joined here, but more medially they're separated by this triangular gap, the superior orbital fissure, which forms a large opening between the orbit and the inside of the cranium. Here's the superior orbital fissure from the inside. We'll get a better look at it in a minute. The pterygoid process of the sphenoid bone projects downward behind the maxilla. The pterygoid process includes the lateral and medial pterygoid plates, which are the attachments for some important muscles that we'll see later. This hollow between the pterygoid plates is the pterygoid fossa. This little hook is the pterygoid hamulus. It's a pulley, as we'll see later. We'll look at 3 openings that pass forwards, 2 openings that pass downwards, and 1 that, in spite of appearances, passes obliquely backwards. We'll start with the ones that pass forwards. This round opening just in front of the anterior clinoid process is the optic canal for the optic nerve. Lateral to it, this large triangular opening is the superior orbital fissure, which we've seen already. Numerous nerves and blood vessels pass through it into the orbit. Below and behind the medial end of the superior orbital fissure, this smaller round opening, the foramen rotundum, is for the maxillary branch of the trigeminal nerve. We'll put this pointer in the foramen rotundum and go round to the outside. Here's the superior orbital fissure again. Here, medial to it, is the optic canal. The foramen rotundum emerges not into the orbit, but into the pterygomaxillary fissure. The 2 openings that pass downward are the foramen ovale for the mandibular branch of the trigeminal nerve, and just behind and lateral to it, the foramen spinosum for the middle meningeal artery. To see where those 2 come out, we'll go round to the underside. Here's the foramen ovale, just behind the lateral pterygoid plate. Here's the foramen spinosum, just behind and lateral to the foramen ovale. The last opening to look at is this untidy-looking opening, the foramen lacerum, for the internal carotid artery. In a dry skull, the appearance of the foramen lacerum is quite misleading. It appears to pass straight down through the base of the skull, emerging here at the tip of the petrous temporal bone. In the living body, the apparent opening on the underside is filled in with dense cartilage and fibrous tissue, represented by this material. Fibrous tissue also fills in this ragged part of the internal bony opening. What's left of the foramen lacerum is a clean-cut opening through which the internal carotid artery emerges from its obliquely running bony tunnel, the carotid canal. The other end of the carotid canal, as we saw in the previous section, is back here, just medial to the styloid process. In front of the opening for the carotid canal, there's one further opening that we haven't seen yet, the opening for the auditory tube, also called the eustachian tube. The auditory tube passes backwards and laterally to emerge here in the middle ear. The auditory tube is longer than this. Medially, it's prolonged by a tube of cartilage, represented by this colored material. The auditory tube opens into the nasopharynx, as we'll see. It is described as consisting of the body and the right and left ramus. The corner between the ramus and the body is the angle of the mandible. The rounded projection that articulates with the temporal bone is the condyle, or condylar process. The narrowing below the condyle is the neck. The sharp, slender projection in front of the condyle is the coronoid process, a major muscle attachment, as we'll see. The dip between the coronoid process and the condyle is the mandibular notch. The angle of the mandible is roughened on the outside and on the inside by the insertions of a matching pair of muscles, the medial pterygoid on the inside and the masseter on the outside, which we'll see shortly. The body of the mandible is described as consisting of the base and the alveolar process. The side of the body slopes upward and inward, slightly on the outer aspect, markedly on the inner aspect. The posterior part of the alveolar process bulges medially above this hollow, the submandibular fossa. This projection in the midline is the mental protuberance. On the inside, this roughened area is the mental spine. Two pairs of muscles are attached here, the geniohyoid and genioglossus muscles. On the inner aspect of the mandible, this thickening below the coronoid process is the buttress. In the middle of the ramus, level with the tops of the teeth, is the mandibular foramen. Just in front of it is a small upward projection, the lingula. The mandibular foramen is the start of a tunnel for the inferior alveolar nerve and blood vessels. A major branch of the nerve emerges on the outside at the mental foramen.